Hello everyone. In today's video, we are going through often repeated questions on the human skeletal system. For our first question, we have how many bones are in the adult human skeleton? We have A 196, B 206, C 210, and D 212. Our answer here is B 206. The adult human skeletal system contains 206 bones, and they are grouped into the axial and the appendicular skeletons. Question number 2. Which bone is the longest and the strongest in the human body? A. The tibia, B. The humerus, C. The femur, and D. The radius. The answer is C. The femur. The femur is the longest and the strongest bone. It supports the body weight during standing and walking. Question number 3. Which part of the skeletal system protects the brain? We have A. The facial bones, B. The vertebral column, C. The pelvic girdle, and D. The cranium. The answer here is D. The cranium. The cranium, as part of the skull, encases and protects the brain. Question number 4. Which of the following is one of the functions of the skeletal system? We have A. Hormone production, B. Temperature regulation, C. Blood cell production, and D. Enzyme secretion. Our answer is C. Blood cell production. The bone marrow in long bones produces red and white blood cells. Question number 5. The vertebral column consists of how many vertebrae in total? We have A. 24, B. 26, C. 30, and D. 33. Our answer is D. 33, because you have 33 vertebrae in total. You have 7 cervical, 12 thoracic, 5 lumbar. You also have 5 fused sacral and 4 fused coccygeal. Now, to help you remember this, think of breakfast at 7, lunch at 12, and dinner at 5. Then you think of a 5 fused sacral and 4 fused coccygeal. So when you think of the breakfast at 7, you think of the 7 cervical. When you think of lunch at 12, you think of the 12 thoracic. And when you think of dinner by 5, you think of the 5 lumbar. Question number 6. Which bone forms the pectoral, the shoulder girdle? We have A. The scapula and the sternum, B. The clavicle and the scapula, C. The humerus and the scapula, and D. The clavicle and the humerus. Our answer here is B. The clavicle and the scapula. Now, the pectoral girdle consists of the scapula and the clavicle, and it connects the upper limb to the trunk. Question number 7. Which of the following bone is part of the axial skeleton? We have A. The femur, B. The scapula, C. The vertebrae, and D. The radius. Our answer is C. The vertebra. The axial skeleton includes the skull, the vertebral column, and the rib cage. Question number 8. Which type of joint is formed at the shoulder and hip joint? We have A. The hinge joint, B. The pivot joint, C. The ball and socket joint, and D. The saddle joint. Our answer here is C. The ball and socket joint. The ball and socket joint allows for the widest range of movements in all directions. Question number 9. Which mineral is most abundant in bone tissue? We have A. Potassium, B. Iron, C. Calcium, and D. Sodium. Our answer here is C. Calcium. Calcium phosphate makes up much of the mineral content of the bones, and this helps to provide strength and rigidity for the bones. Question number 10. The smallest bone in the human body is called the steps, the hyoid, the metacarpal, or the fibula. The answer is actually the steps. The steps are found in the middle ear, and it is the smallest and the lightest bone in the human body. So our next question is question number 11. Before we move over to question number 11, please give this video a thumbs up. Go ahead to like the video, and you can also subscribe for more content like this. Thank you. Question number 11. Which bone does not articulate with any other bone in the human body? We have A, the mandible, B, the hyoid bone, C, the sternum, and D, the temporal bone. Our answer here is B, the hyoid bone. The hyoid bone supports the tongue, and it is actually unique because it does not form any joint with any other bone. Question number 12. Which part of the bone contains the bone marrow? Remember, we talked about the bone marrow earlier, and it is where white and red blood cells are formed. So our first option, we have the epiphysis, B, the periosteum, C, the diaphysis, and D, the endosteum. Our answer is actually C, the diaphysis. The diaphysis, or the shaft of a long bone, contains the modular cavity which houses bone marrow. Question number 13. What is the primary function of osteoclasts? We have A, form new bone, B, reabsorb bone tissue, C, support cartilage growth, and D, produces red blood cells. Our answer is B, reabsorb bone tissue. The osteoclast actually breaks down bone matrix during bone remodeling and calcium release. Question number 14. How many ribs are found in the human body? We have A, 10 pairs, B, 11 pairs, C, 12 pairs, and D, 13 pairs. Our answer is actually C, which is 12 pairs. There are actually 12 pairs of ribs. We have the true ribs, the false rib, and the floating ribs, and they all make up the rib cage. Question number 15. Which bone is commonly called the collarbone? We have A, the scapula, B, the clavicle, C, the sternum, and D, the humerus. Our answer is B, the clavicle. The clavicle, also called the collarbone, helps to connect the sternum to the scapula, and this helps to stabilize the shoulder. Question number 16. The type of joint between the skull bones are called the hinge joint, the pivot joint, synovial joint, or the suture joint. Our answer here is actually D, the suture joint. The skull bones are joined by immovable sutures that fuse during development. Question number 17. Which bone forms the lower jaw? We have A, the maxilla, B, the mandible, C, the zygomatic, and D, the palatine. Question number 18. Which bone is located in the forearm and is on the thumb side? We have A, the ulna, B, the radius, C, the humerus, and D, the scaphoid. Our answer is actually B, the radius. The radius is actually lateral when you place your arm. The radius is actually lateral when you place your arm on a true anatomical position, and then it kind of aligns with your thumb. Now this is very important for radiography students or radiology students, because when looking at a radiograph of the hand and you see the bone that aligns with the thumb, you can easily use that to identify the radius. Question number 19. The socket part of the hip joint is called the A, the olecranium, B, the glenoid cavity, C, the acetabulum, and D, the fossa ovalis. Our answer is actually C, the acetabulum. The acetabulum is the deep socket in the pelvis that receives the head of the femur. Question number 20. Which of the following bones is part of the appendicular system? We have A, the sternum, B, the rib, C, the scapula, and D, the sacrum. Our answer here is actually C, the scapula. The scapula, or the shoulder blade, is part of the appendicular system, and it is involved in limb movement. So there you have it, 20 questions on the human skeletal system. You can go ahead and like this video and also subscribe for more content like this. See you in the next one, and thanks for stopping by.